Coming up today, a suspicious mole leads to brain surgery. Coming up, a cancer survivor who faced a daunting prognosis. He now reunites with his favorite doc. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. When Tim Grimes learned he had skin cancer and that it had already spread, a doctor gave him 9 months to live. That was back in 2014. 9 years later, he's alive and well and giving hope to patients facing a similar diagnosis. We catch up with Tim in our latest edition of Where Are They Now? And so glad to have Tim joining us from home this morning. Good morning. How are you?
I'm great. How are you?
Good. Good to have you with us this morning. Here with me in studio is Tim's medical oncologist, Dr. Gary Doolittle. Welcome to you. Good to see you.
Good to see you, too.
And we're also joined by Kristen Burkett. She is joining us live today. Kristen is Tim's oncology nurse practitioner. Gosh, goodness. Kristen, how are you today?
I'm good. Thank you.
Good for being with us today and back, kind of getting the gang all back together again, because you've been telling me about Tim for quite a long time.
9 years.
9 years, 9 long years.
I've been telling people about Tim.
Yeah,
for 9
I know.
years.
You've been sharing his story. So, Tim, we've got a lot to talk about and get caught up on. Let's talk about the diagnosis, the treatment, the support from the community. But most importantly, we just want to find out how you're doing. What does life look like for you today?
Well, I can say in all honesty, life is good. There was a time when I would say that just to sound good, but right now I'm pretty happy with where I am. Got a cool job as a fancy chauffeur. That's a lot of fun, keeps things interesting. Just moved into a house from an apartment at the end of last year. Got a new dog, taking care of myself. I mean, honestly, life is good. It's definitely crazy to look back and see where I'm at now, or see where I've come from and where I'm at now. And like I said, honestly, I can say I'm feeling really good.
You're appreciating all the things life is offering. Yeah, cool job, a dog, a place to live, just gratitude, it sounds like.
Absolutely. Yeah, that's something that I'm getting better at practicing is gratitude, because I wasn't supposed to be here, and not only am I still here, but things are great. So I'm definitely appreciative of that.
You're here and doing it well. Okay, but you got to back up, because I want to go back to this diagnosis. You were 28 years old at the time. You had a mole on your back. You go to get it removed, and at that point, was cancer even on your radar?
No, definitely not. A friend had pointed out the mole that was on my back. We were at a pool, and she said, hey, you might want to get that checked out. My mom had melanoma, something we don't take lightly. So there was kind of, she planted that seed a little bit. But by the time I got it removed, I just wanted it gone because it was really gnarly looking. You could see it like protruding through my shirt. So at that point, I just wanted it gone. And the place I went to, they originally said, oh, this is probably nothing. I'm not too worried about it right now. So at that point, there was a big feeling of relief. But outside of that, I didn't feel any symptoms. Looking back, the few months prior to that, I was extra tired and sleeping a little bit more. But at the time, it was hard to really know, that was cancer related. But I didn't feel like a cancer patient. I didn't feel like I had cancer. So that was definitely something that was very surprising. I just wanted to get this ugly mole removed. I had no idea what was in store for me.
Well, and I love it. Dr. Doolittle, I have to say, I love that someone noticed it on him, and that's what made him go. We find that a lot, where people see something on another person or someone that they know and love and care about and say, hey, get that checked out.
Exactly.
Really important.
That was
so
brilliant.
Doctors diagnosed you. What's that?
I'm definitely that guy now. I will be like, hey, you want to get that mole checked out?
We call that mole patrol. So you're like constantly looking at people and going, did you get that checked out? I ran into a friend the other day and she's like, have you had this checked out, this like brown spot? I said, I have, and I've got an appointment with my doctor. Don't you worry. So yeah, we're always looking out for each other. The skin is a lot to cover. So tell us again, so you're diagnosed, they tell you you have cancer. What was this like? How did you act emotionally to this?
Well, I was originally diagnosed at another hospital before KU, and that's where I got, the surgery done and everything. And it was just so hard to believe that I couldn't really process it. The doctor came in, and just the way he was kind of struggling to tell me what was going on, I knew it was serious. And then when he told me, it had spread, and it was just hard to believe. So I think in a weird way that kind of helped, because I just didn't really know what I was dealing with. And I was also with my parents, and they were kind of, they were reacting the way you would expect. So I think, them just kind of being a little bit, thrown off, it almost kind of helped calm me down, because somebody in the room needed to stay calm. But yeah, it was just so surreal and hard to believe that I didn't really know what to feel. It wasn't really, honestly, until I met with Doolittle that I started to notice this, or know the severity of it. But at first it was just kind of like, okay, what do we have to do? Let's do it. And that's right after that, when I first met with that other doctor, is when I made the announcement on Facebook. And from there, my story started to kind of spread, and that kind of helped distract me from what was going on, and the support started rolling in and made it a little less scary. I'm kind of jumping ahead here, but yeah, I mean, it was just hard to believe. It was like somebody saying, hey, you now have $1 billion, and I couldn't really comprehend that. So it was just like, okay, how am I supposed to feel? I feel fine. So it was just a weird, almost like denial, I guess. I don't know. It's hard to describe now looking back, but it was definitely just, at the time, I didn't really know what to think, because I didn't know how to comprehend it.
Yeah, I bet. It's a good way of putting it, describing it to being given $1 billion, because you just cannot quite get your head around the news, or even what that even means. So you come here, you meet Dr. Doolittle at the University of Kansas Cancer Center. Dr. Doolittle, tell us first, what's it like seeing Tim today, but then just take us back to when you guys first met as well.
Right. Well, it's so gratifying to see Tim today. I mean, he's doing great. We've had a 9-year relationship. I mean, it's almost become, well, it's definitely become a friendship over 9 years when you know someone that long. And watching him evolve and go through some of life's most serious challenges with a lot of dignity, and at times, Tim, forgive me, but at times maybe a little craziness through all of it. Always smiling, always smiling, always trying to have a lot of fun in the midst of really difficult times.
I want some details on that. What do you mean craziness?
Just, always a joke to tell, always trying to keep it positive. The nurses would get such a kick out of him up in treatment, because he got to know them and they got to know him, and it was even with as serious as it always was, his way of coping worked really well for him, and we really responded well to that too.
You've talked about Tim for the last several months. Just to me, and I just get this feeling he's a very special, memorable patient of yours. Like you said, patient turned friend.
No doubt, patient turned friend.
Kristen, same question. You're part of the bigger picture, the bigger team. What was it like, and what do you remember when you first met Tim?
Yeah, the thing I remember most about Tim was that he really had faith in the process. Even 9 years ago, when we didn't have the treatment options weren't as great for melanoma as they are now, he never questioned what we were doing or questioned if it was going to work or not. Even when Dr. Doolittle and I were, hesitant about, we're not sure, if this is going to work, or, life expectancy. And he never questioned that. He was very unwavering. And I mean, look where he is now. So that's the main thing I really remember about when I first met Tim, and then even to this day.
So with stage 4 melanoma, the treatment has to be aggressive, I understand. Mm-hmm. You were able to get Tim into a clinical trial. Tell us about that.
Right. That was really interesting too. And again, Tim is kind of like a history of the modern treatment of melanoma, because the first clinical trial he was involved in was an older agent, a drug called IL-2, and then a newer agent that was given in pill form that fits into a category called BRAF inhibitor. And without getting into all the details with that, it was something new and edgy and different, and Tim was willing to try it. He's like, okay, I've got a cancer that isn't we don't think is curable, and we're going to try something new and different. And the wonderful part about that is every drug we have in the clinic today comes to us because somebody like Tim was willing to take a risk and be selfless and participate in that process. And while that trial didn't work out the way we wanted it to, that is how our field is advanced. So Tim participated in that, and that didn't work, and then we had multiple other options that evolved over time that obviously did work.
Tell us how it spread. We talk about melanoma as a skin cancer. Where did it run off to?
Yeah, if you just take melanoma in general, it spreads through either the lymphatic system, so it will go through lymph and then into lymph nodes, or it can go through the bloodstream. And between those two mechanisms, melanoma is a disease that can pop up anywhere. And I mean, even we tell our residents on boards, if you have a question about a cancer patient, it seems a little odd, think melanoma, because it can pop up anywhere. And in Tim's situation, it did. I mean, it was in multiple areas through the body, and ultimately even brain involvement. So it was a huge challenge, I think, all the way through. Tim,
you were mentioning earlier, because all this was happening, your friends and family started sharing your story far and wide. Even local media picked up on your story. Kansas City Royals, the Kansas City Chiefs took notice. How did it feel to get all that? That's pretty special attention. What was that like for you?
That was, just another surreal chapter to it. It felt good. I mean, it was fun. And I think that's what helped keep my spirits up. And after a while, it just became bigger than me. There was other people that were supporting me, other people that were inspired by me. I had so many people come up and say, hey, my dad saw your story, decided to get checked out, and now, he's battling cancer, and life is good. Like, people beat cancer because of me. Or I hate to say because of me, but, they went and got themselves checked or decided to keep fighting because they were inspired by my story. So just after a certain point, like I said, it became bigger than me. So I wasn't just fighting for me, I was fighting for other people. And that helped keep me going. And then, of course, just had a blast. And there was so many events that I got to go to, so many people that were reaching out and helping me, that it was hard to get down because I had other people there to lift me up when I needed it. So I think that just kind of added to the surreal aspect of it and helped keep me going. And, I was going through something terrible, so I was trying to counterbalance that with fun. And that definitely helped. And, again, just having people tell me that I inspired them and kept them going was great.
Yeah.
A friend in high school, her dad, knew something was up and went and got checked, ended up being cancer, but he beat it. And now he has time with his grandkids and stuff like that. So that was awesome. And that really helped keep me going. And, aside from that, I was having a blast too.
That's good. Yeah, because cancer isn't a blast. That's not what we think of. So to think that you're kind of thrust into this new realm, this horrible diagnosis, then turns into this new mission for you, kind of making it all worth it. Kristen, how important is it for someone like Tim and the patients you treat to have that kind of support during this time, reaching out to people, especially when it comes to things like skin cancer? Again, it's something that can affect anyone at any time, and it isn't always top of the mind. But to have someone like Tim out in the community reaching people.
Yeah, when he was talking about just having people seeing his story and then, paying more attention to their health. We have patients still to this day that will bring up Tim and will say, hey, that Tim Grimes guy, do you know him, or how's he doing? So even, from his diagnosis 9 or 10 years ago, it's still impacting people today, which I think is huge. It gives people hope.
For sure. Yeah.
Quick Tim story.
Yeah.
I'm going to get myself in trouble here.
Get it.
Tim used to plan all of his treatments around Royals' schedules and the Chiefs' schedule. That's the way I remember it. And we had to kind of be flexible with him and work with him on that. Even his first round of treatment, he flies to, was it Los Angeles, Tim? He flies to a game, Royals, Chicago. And we were all kind of like, okay, Tim. And the lesson was, Tim was taking immunotherapy, chemotherapy treatment to live. He wasn't living just to take treatment, right? And we knew that, and he made sure we knew it, and we worked around it.
I love that.
That's what I mean about the little crazy. There was just a little crazy.
Like, yeah, he just kind of found those little ins and outs. And you're right. We think when you're diagnosed with this daunting cancer, it's like you got to focus on the cancer every day, all day. And he's saying, nope, cancer's going to have to work around my life.
No,
that's a really,
exactly
really good lesson. And kind of on that note, Tim, when did you start to feel like you had more than just a few months to live from what they had originally said?
I mean, it was very back and forth. The first treatment that we did, that clinical trial, I think the first scan showed that it was working. And then, it was very back and forth. But once it spread to my brain, that was when reality set in. And I thought, this could be it. And part of the reason, from the beginning, why it was so important to me to have fun, is as much as I may have been in denial or acting crazy, I knew what I was up against. So I was just kind of treating this like, there's a good chance I'm going to die. There's a good chance I only have 9 months left. So, that could have been my last royal season. So I wanted to soak it all in while I could. And so that's kind of what it was, just like, hey, I know what I'm up against. I know I don't have, very good odds here. So I'm going to make the best of it and have as much fun while I can. And then, started to see that things were working, and we had to try a bunch of different treatments, but overall I was still getting good news more often than not. But once it spread to my brain, I definitely thought, okay, yeah, this might be it. But that also is what gave me more strength to fight, because I just had to push on a little harder. And it was just kind of like I had no choice. I didn't want to sit around and feel sorry for myself. It was a daunting task ahead of me, so I just had to do what I could to make the best of it. And, it was very back and forth, which was tough mentally, but, I just had a great support system, so that helped keep me going. But I think, it was tough because the cancer throughout the rest of my body was disappearing, but then it hit my brain, and that's where it was like, okay, I really might be on my way out here.
Is it typical for it to spread to the brain?
Absolutely. At least 50% of melanoma patients would sometime in their trajectory wind up with metastatic disease to the brain. Now, those are older data. Now, with all the immunotherapy and the targeted agents we have, we may find that the percentage is not that high.
Okay. So, Tim, you were kind enough to let us head into the OR with you when you were going in for brain surgery. Just tell us a little bit about what were you thinking when you were heading back?
That was just another surreal part. That was another, like, okay, I guess this is what I got to do. At that point, like I said, that's when I really thought that maybe this was it, and I just was doing what I had to do. This whole thing has been surreal, and that was just one more thing that, didn't feel like real life, so it was almost just easier to kind of go with the flow. And at that point, I'd already come that far. What's a little brain surgery?
Yeah, right. All in a day, no big deal, right? You can take this, Tim. We don't know if you've ever seen this video or anything, but if anybody who might be a little squeamish, you might want to look away for a moment. But this is the moment that they remove this like suspicious tissue from your brain. It turned out, I guess, Dr. Doolittle, this was not a tumor, right? This was like just some dead tissue from like radiation. I mean, interesting nonetheless, but what is that coming out?
Right. The medical jargon is radiation necrosis, or it's breakdown tissue, but sometimes with our modern day scanning, you can't tell whether it's active melanoma or if it's broken down tissue due to radiation. And particularly in that era, we were sending more patients to the OR, and as it turned out, it was not active melanoma, and Tim recovered and did really well. But that's when Kristen and I were both really worried. I mean, that second go around, we thought, we're always you're always worried. You're a cancer doctor. We're cancer people.
Right.
But that's when we thought we were worried we were going to lose Tim.
Kristen, what were your thoughts at the time?
Yeah, exactly what Dr. Doolittle said. We were concerned that, maybe this one he wasn't going to rebound from. But again, what has always impressed me so much with him is he never questioned it. He always felt like he was going to recover. And again, here he is.
Here he is. Tim, what's the follow-up care look like for you these days?
Regular skin checks. I go to the dermatologist every 3 months and still see Doolittle for scans and checkups. And, just on my own, I'm definitely taking care of myself more now. Eating right, exercising, making sure I stay in a good mental space, and just being more proactive in general. I'm not afraid to say, hey, something doesn't feel right, or something feels off. Whereas before I would try to, just power through or whatever. But now I'm a little more vigilant as far as taking care of myself and staying on top of anything that might be concerning. Mostly just to feel good too. I didn't go through all that to spend however much time I have left feeling bad. So I now do what I have to do to feel as good as I can throughout the day, but also to stay on top of any health concerns as well. But luckily, the skin checks are still happening, and there's still some stuff that, hey, we might need to get this removed, but overall health is good and life is good. So, yeah.
Good to hear it. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. The info is right there on your screen. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning.
Yeah, hi.
Hey.
How are you?
I am good, thank you.
Well, we ran through our active numbers of COVID patients. Again, we're just giving it weekly. Currently in the hospital, we have 16 active patients. Unfortunately, COVID is the gift that just keeps on giving and has been now for several years. So we are kind of just dealing with that increased circulation of the virus around. And of course, we're looking about prevention now.
A few things that we need to get to with you today, because there's finally a movement on the new COVID shots that a lot of people have been wondering about, myself included. FDA approved the shots yesterday. Today, the CDC is expecting to officially recommend the shots. No surprises. Now we're just kind of waiting for them to be available and shot in the arm, right?
Yeah. Prevention is best, just like you mentioned, and that's the big news that we are awaiting. We are waiting the full recommendations. The FDA did approve them. So that means now with the approval of the new monovalent, meaning just kind of one spike in the shot, the previous one that we have been using almost for the past year, the bivalent, is no longer authorized. So we are waiting the eventual supply of that to start giving. But more importantly, we are waiting for the full recommendations of exactly who will be recommended for it and in what case. Is it going to be a blanket, everybody 6 months to to 65 or 80 or whatever age is going to be recommended, or is it going to be those at highest risk recommended and then some other clinical decision-making discussions with your provider? So is it going to be like the influenza vaccine, that it is just all, everybody is recommended to get one, or again, will there be some stipulations in there?
We will wait and see.
Yeah.
All right, Hawk, also, you have some data from the Kansas Department of Health and Environment. This is the KDAG graph showing the percentage of emergency department visits for respiratory illnesses, whether that's flu, COVID, anything else. We see two big spikes right here. What are those?
Those two big spikes are from the previous couple years, November, December 2021, 2022. Obviously, if you look to the far right of that, that is all that time from that from that second largest spike all the way over to the right. Now what we are seeing in the very far right is the current increase in the percentage of visits to a facility, an ED or an urgent care, for respiratory illness. Now, just as you said, Jessica, respiratory viral illnesses can be due to anything. Obviously, we think of COVID, but also influenza, RSV, and then there's also those common cough and cold viruses as well. So as you can see, the percentage, the number has started to tick up compared to where it was a couple months ago.
All right, Hawk, thank you so much. Any reporters with us today? All right, let's get to our community questions. Angie has a question, and Dr. Doolittle, since you're here, let's talk about it. Can you tell us a little bit more about the skin cancer that Jimmy Buffett passed away from?
Right. That's a cancer very different from melanoma. It's called Merkel cell carcinoma. The incidence of it is much less than melanoma. We see about 2,000 cases a year.
But it's aggressive?
It's very aggressive if it metastasizes. If you cure it with surgery, which is the best option, best way to approach it, that's great. But once it metastasizes, it's aggressive. We used to think it was better than melanoma because it was chemosensitive. Now it's just the other way around. Melanoma is a better prognosis than Merkel cell if it spreads.
Really? Because you always hear melanoma is the word you do not want to hear, but Merkel cell, although rare, very much more aggressive.
If it metastasizes,
If
yes.
it metastasizes. Haley wants to know just how often should we be getting skin checks? I get it yearly just because I've had some skin cancer on myself, but does that mean everybody needs to be doing it annually?
Right. I recommend an annual skin check.
No matter what your risk level?
Right. There's a 2% risk plus a little bit higher for the average American for melanoma alone. I also think once you get in, you get that skin check in with your provider. They'll give you a recommendation on follow-up. Dermatologists may recommend more frequently depending upon what they see on exam. Primary care practitioner may say, once a year is good. Great. Let's work with that.
Angelina wants to know, what's the benefit to immunotherapy drugs compared to something like chemotherapy?
Yeah, they're really just such different categories and different ways of treating cancer. The first thing I tell a patient that's about to start immunotherapy is this is not chemotherapy. Because everybody has a good idea of what side effects are associated with chemotherapy and nobody wants it,
Correct.
right? And I'm not telling you that immunotherapy doesn't have really serious side effects, it does, but they're different. And so we start off with, this is not chemotherapy. These drugs are used to harness your own immune system, the cells in your immune system to fight cancer. That has a lot of personal appeal for patients, right? I like to think my body's fighting this as opposed to chemotherapy or a chemical that's going after it.
Yeah, that makes sense. And on that note, Chelsea wants to know, Tim, what were the biggest side effects you had from your treatments?
I definitely consider myself lucky in that regard. I met a lot of cancer patients throughout my battle who were going through chemo and immunotherapy and had a lot of side effects. Luckily, mine were pretty limited, definitely fatigue and exhaustion. Joint pain being the biggest one, especially in my shoulders. I just was very achy. But outside of that, I really was pretty lucky. I, didn't spend any time being nauseous. I was still pretty much able to function as normal, aside from the aches and pains from the treatment in my joints. But other than that, I mean, really just fatigue and some joint pain. And outside of that, I really didn't have a whole lot of side effects. So I definitely consider myself lucky in that regard. Because like I said, I met a lot of people who I felt like had it a lot worse than me. So, yeah, I mean, side effects were pretty minimal for sure.
I want to get our takeaways today from our conversation, and I'm going to start with you, Kristen. What do you want folks to take away from this conversation?
I think the biggest thing to take away from this is that, cancer diagnosis can be, bad diagnosis, bad situation. But like Tim is here showing us that you can, get beyond it. There are good treatment options and you can survive and still live a good life.
Yeah, with a good team as well. Kristen, thank you for that. Dr. Doolittle, what's the takeaway?
Yeah, I think I would echo some of Kristen's comments that melanoma, stage 4 melanoma was 100% non-curable 14 years ago. And now we think better than half of our patients, even when it spreads and is as rough as Tim's situation was, can be cured. So it isn't, the classic expression we hear is this is a death sentence. And my comeback is it's a whole new world, and we're going to be thinking in terms of the long term. We're not thinking in terms of just trying to control for a short period of time.
I love that. That's the hope that people want to hear.
Yeah,
Dr.
it's great.
Doolittle.
It's been great to watch it evolve over the last decade.
I bet. And it comes through in like the friendship that you build with Tim and your patients who've lived it and are still living it. Thank
Great.
you.
Thank you. My pleasure.
Good to see you. Tim, what do you want folks to take away from your story?
I definitely stay on top of getting your skin checked, getting your health checked out in general. Never think it can't happen to me. I was 28 and healthy and, came very close to dying. I've met so many different people from all walks of life that had cancer. So it's definitely, doesn't discriminate and everybody's at risk. So stay on top of your health. Make sure you trust your team, like what we were all kind of saying. There was a point where I was on steroids and literally was not thinking clearly and was kind of a little crazy. And I remember thinking, like, I'm not doing anything unless Doolittle or Kristen signs off on it because I trusted them that much. you just got to keep going. You know, there were times when I could have given up or stopped fighting, but you just have to keep going because you never know what's on the other side. And for me, it was a clean bill of health. So stay on top of your health, get everything checked out, trust your team, and just keep going.
Great message, Tim. Thank you so much for sharing your story. We're just glad you're living well.
Thank you. Absolutely.
Dr. Hawkinson.
Yeah, we were talking about the visits to emergency departments for respiratory viruses. I was talking with the doctor at the KDHE yesterday, and it should be noted that right now, really what they are seeing all throughout Kansas for respiratory viruses is mostly abundantly COVID-19. There's not any or a lot of circulation of RSV at this point in time, or influenza, or those other common viruses. What they're overwhelmingly seeing is COVID-19, is SARS-CoV-2. So we should point out too that there are free testing areas and sites around Kansas. And if you go to this website, this is a KDHE website, you can click on a link, scroll down to a map. It is an interactive map, so you can see where you live around close to you. Those blue sites are the testing sites. You can then focus in and specifically hover your mouse over those blue sites, and you can see exactly where that free testing for COVID-19 is. So hopefully that keeps you and your loved ones safe. Again, if you have symptoms, very important to test early. And if it is positive, if you in that high-risk category, get on Paxlovid.
All right. Thank you to all of our guests today and to our viewers for being here with us. We'll see you back here tomorrow.
Coming up Wednesday on Open Mics with Dr. Stites. He went to the ER for a stomach ache, and 24 hours later, he was admitted for emergency surgery. I'm Alexis Del Cid on the next Open Mics with Dr. Stites. His journey, remarkable recovery, and what you can expect if this happens to you. Wednesday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.